and welcome to yet another episode of Hall of Fame interviews. Today we have with us a very good senior and enthusiastic doctor, Dr. Kavita Dubey. She is also a very good friend and we have been childhood friends, and she has prospered well in the city of Jabalpur. We also welcome Kavita.
Thank you. It's a pleasure having you here at Jabalpur.
Yeah.
Back from my childhood memories to where we stand today.
So you have done BDS, MBS and PhD.
Yes.
So you are having the highest degree in dental, right?
Yes, I think so.
So how much it is important that you should do MBS and PhD everything?
If you are into clinical practices, that's why all of us pursue this course. MBS is essential, like it would be essential for any doctor to do post-graduation after doing MBBS. The reason being, you're specializing in a particular field, and the patient today seeks the best of treatment, and for that you need to be qualified, as well as precisely you need to have practiced that much of work. That comes in only from masters.
How did you start your practice?
I started off by working with one of the most senior dental surgeons of Jabalpur, and I was attached to a dental college, the Putani Dental College, where I'm still attached to. So that builds in a lot of patience. It gets you associated with a lot of students, and you get a lot of work to do, which really builds in confidence. Because confidence is one thing which is really required for clinical practice.
So people say dental is not having very good future. This is a misnomer, or it is actually a fact?
It's a myth. Any field, obviously it's not like there were very few dentists 20 years back. We are not in the same era. But giving quality treatment to your patients, giving them good practice, good work, it's going to prosper you. You need to be with the best knowledge and with the best heart.
There is space always at the top.
Yes, everyone has space, everyone can prosper, and everyone can be best.
So tell me, how difficult it was as a female to pursue medicine and then going ahead so much in life? You have got cooperative parents and cooperative husband.
I have very supportive parents. My parents, I come from a background of business, right? Wherein even now in this generation, most of the women are working at home and they're not working out. But my father was strength who really allowed me to do everything I wanted to do. I got the best of education and the best of family support. And again, I would say more than a cooperative husband, I have a very supportive husband who's more keen on what I do outside than what I do at home. Right? A day off and he tells me, "Kyun kaam pe nahi gayi?"
Yeah.
So he wants me to work. A constant push is there, because as women, when we want to sit back, look at our children and our house, somebody needs to be there to push us. No, there's something more what you have to do.
So she comes from a Marwadi Jain family, which is usually girls don't study that much, or very few girls study.
Yes.
She's one of the icons in her community also. And let me congratulate that you pursue with your education and with the highest degree in the dental department.
Yes, thank you so much.
Yeah. And another thing I want to ask was, what is the basically setup? Like how much you need to do in a basic setup, small dental setup, how much you need to invest and how it is possible?
Well, again, there are a lot of myths associated with it, that dentistry involves high-tech gadgets and a lot of expenditure to start with. Well, that's not true, because you can start with a small setup. Your knowledge and the basic skill which you develop during your education is what's going to help you. A root canal treatment can be done with a small endomotor. You don't have to buy high-tech, high-end gadgets. All what you need to do is be truthful to yourself and the patient. Do not go in for shortcuts, because dentistry is something which it's like a signature which you put on the patient. Even when the patient dies, a radiograph will tell what kind of treatment you've done. It's a landmark. So you need to be truthful to yourself, do the best treatment what is possible, and tell the patient, "Okay, this is what I have done."
That was good. And what are the challenges in the modern day dentistry which you observe when you are starting practice?
The the biggest challenge what we have is Google. Patient comes in with Google knowledge, and like we want single visit RCs, we want painless root canal, we want painless extraction. Well, in reality, there will be less pain. There's something or the other which is going to come up on the treatment, so you need to be really truthful to the patient. Like people want single visit root canal treatments. All cases are not indicated. So the newer dental surgeons who are coming up, they need to have that confidence that they can talk to the patient. Well, this is how it is.
You have to actually tell the facts.
Tell the patient.
Right.
And today's patient is an educated patient. He'll listen to you. He'll try to understand.
So what is the future in cosmetic dentistry?
Well, cosmetic dentistry has a big future. You have a lot of laminates, veneers, full ceramic crowns, people call it zirconia, emats. Everything is what the patient wants. Now the patient is not looking for metal fillings, for metal caps. Everybody wants something which is very, very pleasant, and that has a lot of money. So it's a very revenue earning branch.
So what is the one thing you want to tell to the young pass-outs or young people who are getting into business? How should you approach and how should you plan?
Well, you should plan with, I think they should be associated with a senior dentist initially, right? Keep themselves grounded, interact with a lot of patients who come to the practice wherever they are working, and then start up their own work. And they shouldn't be starting with big expectations. Patients would naturally come. India is a very, very populated country. So there are a lot of patients. And now patients are not like before that they want every tooth removed which is paining.
Dentistry, especially one patient has 32 options.
Yes, every patient gives you 32 options, and every patient has a family which can be multiplied by 32. So it's a huge scope.
So what has been your successful practically?
First thing is, thank you for calling me successful. And I think patience.
So
Patience.
patience with patience.
Yes, definitely. And be truthful. Something can go wrong in your treatment. With dentistry, it's easy. We are not handling diseases which are life-threatening. Something goes wrong, you can always inform the patient. A tooth which has gone wrong can be removed and replaced very, very nicely and aesthetically.
So great. It was great talking to you and quite inspiring also.
Thank you so much.
I think the young dentists who are entering this field will be enormously helped by this talk. It was a brief one, but it was nice.
Thank you so much.
Thank you.